So welcome everyone to our webinar today, Building Resilience for Frontline Folks, one in our series on resilience, sponsored by the Henry Luce Foundation. My name is Michael Skaggs, and I'm Director of Programs at the Chaplaincy Innovation Lab. We're very happy to have you with us today. Before I introduce our guest, let me give you a couple of quick reminders. It's old news for the veterans here, but if you're new, this is important information. Like most of our events, this is being recorded, so if you need to leave early, or if you miss a point you want to come back to, that's no problem. We'll send you a link to this recording in probably a week or so. You can go back and watch it as many times you want, whenever you want, so no problem there. When you get that email with the recording, there's a little link in there to a feedback survey to let us know what you thought about this. Please just take like literally a minute or two. It takes almost no time at all to just let us know what you thought and what we can do in the future to be more helpful. Let me introduce our guest, the Reverend Dr. Liam Robbins, who is Manager of Clinical Pastoral Education and Interfaith Chaplain at Lankenau Medical Center, part of the Mainline Health System in Pennsylvania. Liam's team was one of 16 to receive a grant in our Building and Supporting Resilience program, and we are very happy to offer this webinar today. Liam, I turn it to you.
Thank you, Michael. I really appreciate it. I appreciate having the opportunity to share. So as Michael said, I am at Mainline Health at Lankenau Medical Center, which is just west of Philadelphia. And we are situated mostly in the suburbs just west of the city. I am on land that belongs to the Lenape people and prefer pronouns are they or he, just to give you a little bit of social location. But I really want to kind of continue to talk and walk through this with you all. My goal is to do a combination of story and some practical, and hopefully that meets everybody where you are and need. And this will work if I can get my slides to move forward. Here we go. Okay. So I do want to give a special thanks to the Luce Foundation and to the Chaplaincy Innovation Lab. I mean, this is just a huge project to be able to be involved with, and I'm very excited about it. And I appreciate that when the COVID began, that Luce really understood the impact that this could have. And when the announcement of this grant came out last year, I really knew I needed to try to get the grant. I've never written a grant before. Some research is just beyond my brain capacity. I'm a people person, but I didn't need a lot of data to tell me how many people were feeling burnt out in the midst of COVID. I mean, I saw it with my own eyes and the staff in my hospital, and I saw it in myself. And with that awareness that a second wave would come in the fall and this winter that just passed, I really felt desperate to do more for my staff. And I'm sure that's a feeling lots of chaplains had across the country. And so for me, this grant was just a perfect path to take care of that. So some of it was to care for myself, but most of it is to care for my staff, who I consider my Mainline Health family. So I spent the summer really working on this application and finding something that felt new and something doable that I could bring to Mainline Health. And so that is what my project is. But again, I really wanted to thank folks for that. The Luce Foundation, just creating that opportunity, is just a profound experience to work with them. And the Chaplaincy Innovation Lab is always doing such a good job helping us with these projects, but also doing all these webinars. That has been really helpful throughout this. Special thank you to Michael, Wendy Cage, Daria, who's in charge of finance, and some other folks that are behind the scenes that I don't know really well, but I really appreciate that you have helped so many of us moving forward in this project. I also want to give a thank you out to my administrative support person, Barbara Wadsworth, who is the Chief Nursing Officer and Chief Operating Officer. Sometimes I have trouble with all these acronyms. It's fantastic. I mean, she has been an advocate in supporting chaplaincy at Mainline Health, supporting CPE here, helping us start the program, and then moving forward with this grant opportunity. So I really appreciated that. And I also really want to lift up Annie Allen, who is the teacher who is actually helping us bring this mindfulness onto my campus. And she is certified in the mindfulness self-compassion. And I have a picture of her later of us in action, but she really was essential in being able to provide this. And so I really want to recognize that for her. I want to give you some of the basics here, just so you have an understanding of, again, my location and what's happening. As we started this. All of us know what COVID-19 is, and it's a worldwide pandemic. In my area, we went into lockdown about mid-March of 2020, And by the end of May of this year, we had 1,000 deaths in my hospital system. 350 of them happened at my location at Lankenau Medical Center. And you can see over on the slide that Lankenau is the largest of the hospitals in Mainline Health. It's level 2 trauma, but we have the ECMO care, which is the particular heart and lung machines that became one of the pieces of care to use in caring for our COVID patients, which is really unique and different, and not everybody has the expertise to offer it. And so patients were being transferred here from inside Mainline Health and other hospitals in the Philadelphia area because they were candidates for ECMO and an attempt to really support life and help them overcome COVID. For us, our highest hospitalization happened back in April of what I call the first spring of COVID. And those were really hard days and we didn't know what would happen. And then of course, looking at the coming fall of last year, we were really worried about what would happen. I also want to take note that I use the word folks, and it is not a misspelling. It is a word that I want to use to be inclusive, that there is a continuum of gender, identity, and expression. And it's just a way to capture that, to raise awareness as we move forward. This project is called Building Resiliency in Healthcare Workers, and it's for Mainline Health. And what we did is develop sort of a 2-tier system. The first tier was to provide 6 weeks of training with 3 different distinct groups where Annie is facilitating the group. We meet for an hour and we learn the self-compassion mindfulness. And then the second tier is to take folks from that group and actually train the trainers so that we have 5 people coming out of Mainline Health who are going to go on and become certified in this training so we can continue to bring that to the campus all the time to help build resiliency and create a really caring and supportive work environment for our employees here. And so, like I said, the goal is to immediately address any moral injury, burnout, compassion fatigue, and create a path for that to continually be worked on so that we're always doing our best here. Many of you may be familiar with the works of Christine Neff and Chris Germer. They started the Center for Mindfulness Self-Compassion back in 2012. It's an international nonprofit organization. Their whole goal is to teach people how to have self-compassion using mindfulness to really help people be their best and to create a more peaceful world. It's really kind of their view. What you might not know is that when COVID happened and was coming along, they put together very quickly and validated a shortened version of that program so that it's just for healthcare folks in particular. And that's how it went from being an 8 or 10 week series, being a 6-week and only an hour long, because they recognize not everybody in healthcare is going to have as much time to put aside to learn it, but they still need to know the skills. And this is a particularly stressful time. Just as a practicality, I show you here on the right, one of the flyers we used to announce when the dates were for the group and to start collecting folks to register for it so we could send them a private Zoom link so that it was available only to them. And we had some control over who was registered for the particular class series. This again is just to help explain that first tier that I was telling you about. So it's self-compassion training for healthcare communities. We brought it here for employees who felt like they really needed to work on their resilience skills, who were feeling maybe burnt out. We wanted them to really have something to work on that was positive and encouraging and have that in a community setting. So it's a 6-hour evidence-based adaptation and it is validated. And we met for an hour. Because of COVID, we met through Zoom. Normally that kind of program would happen in person. And then to help try and measure what the outcomes of this, we use the self-compassion scale that you see there. And there's a short form, which also has been validated. It's a very short form of questions on a scale 1 to 5, sort of measuring how well people did at resilience now. How well are they at having self-compassion? How well are they at being mindful? And there's some of the scores that reverse, so to help it be a useful tool and with a lot of validity. So we gave that form and asked people in a survey to fill that out before the class started, at the end of the class, and 6 weeks later, because we were trying to see, do the skills stay? We want to make sure that what we're teaching them, that people are utilizing and actually able to maintain 6 weeks later. So that's that goal. I'm going to show you 6 slides, and they're the 6 slides of what the topics were covered each week. Just to give you an idea, there's lots of mindfulness models out there. And I just thought this might be helpful for someone who may not be familiar with their work. As you can see what it looks like, there's lots of discussions. We broke out. Zoom is great for that because we can have breakout rooms, control who's in the room, and have them come back after 10 minutes. I learned a lot of computer skills this year. And some exercises that they would do. Some were written, and there were invitations to share if you wanted, but you didn't have to share. So we really respected privacy, but we were also trying to build in, and it's naturally part of the model, is a sense of community, so people felt connected to each other. So the breakout rooms are really helpful for that, because it would only be 3 or 4 people in a room, and they would have a chance to really share what they were learning and how that was. And it's a lot of things about that aren't just heady thinking about it, but it also incorporates some touch, like hands on your heart. You can see that in this next slide. Like there's different ways that we can sort of touch ourselves, hugs, things like pat on the back or on the heart was really helpful. So they're, again, very grounding exercises. One of the ones I particularly liked is this one called STOP. And it really stands for stop in what's happening, take some breaths, which I probably should do now because I'm probably talking too fast. Observing what's happening in my body, observe what's around me, and then sort of proceed with my task. And the goal is really, it's a short and simple tool to help me recognize what's happening inside me, what's happening around me, not to stuff down any feelings or deny what I'm feeling, experiencing, but just a way to sort of acknowledge it. Mindfulness is being aware of it, but it also doesn't have to control me, and I can move forward in my day. And it's such a neat tool because you can literally do it in about 10 seconds. And I think it's helpful for even as chaplains to do it for 10 seconds before going into a patient room or going into the trauma bay or approaching staff to see what's going on. So they're really nice, these nuggets that were useful. And I really wanted something like that could really be tools in the toolbox. Talks a lot about in the group about self-criticism and safety. Nurses and doctors and other front workers, chaplains, we're often bad at taking breaks. We're not good at eating when we need to, and we often will self-criticize ourselves during the day and not take care of ourselves. So how do we work on finding ways to motivate with kindness to be good to ourselves and be good to what we need instead of judging ourselves for that? This is one of my favorite movies of all time, the insight, the emotions. And so like really recognizing that we have difficult emotions sometimes inside ourselves, but also outside ourselves. How do we have exercises to sort of help smooth those over, soothe them a little bit, soothe ourselves, so we can again be more mindful and more in control of what we're going to do and what we feel. In this next slide, I incorporated an old yardstick. I don't know how many of them remember them. I remember my grandfather having one of those. And looking at self-compassion and burnout, one of the things that I'm reminded, and it was really helpful as part of this model of self-compassion, is I can only control what's right around me. And so I reflected on the conference of several years ago with Carrie Newcomer and Parker Palmer and her song, 3 feet or so, right? All I'm supposed to do is take care of the 3 feet or so around me. It's called equanimity. And I'm not responsible for other people's journey. I just have to take care of my journey and what's here in my realm, what's in my role. And it's a helpful way to remember, oh, this other stuff isn't my job. I can't impact that the way I might want to. This is what I can impact. So it feels very empowering. And so I use that sort of as a quick model to remind me of that song. And then the last class is, again, evaluating how the practice has been going, helping folks remember what their values are that brought them to healthcare in the first place, and then setting some practical intentions as they move out of the class and to kind of start continually to figure out, how does this adapt? How do I work with it? How can it impact my job? How can it impact my next hour at work? And how does that help me get home and be a healthier person because I'm taking these steps to be more mindful and to be compassionate for myself? So it was a very good class, and it was a neat series. So now, we talked about what that looks like. So now I'm sure you want to know, how did it work? Did it work? What are the results, right? Well, I've got some good news and not so good news. And I think some of you will appreciate this. Those that are also in this project with me and other places, it's really hard to get people to fill out their surveys. So we decided for that first group, we would start and we would offer it Fridays at lunch. So remember, we're trying to get everybody who is frontline. So it's all these folks in the hospital who are taking care of patients, whether they be nurses, doctors, techs, food service folks, maintenance folks, facilities, housekeeping, everybody, and try to get them. And it's very hard to find a time of the day where people can get away. So we picked lunch, hoping we could get some folks there. We wanted a maximum of 20 people in the group. Ideally, 16 is what works. We accepted 20, knowing we would lose some. And so you can see there on week 7, the first week we had 17. And then by the end, it was down to 12. But that actually was a pretty good number and it worked well. We did the Zoom live. We did not record it. The group consisted mostly of nurses, some HR people, patient experience person, bereavement counselor, some chaplains, social workers. A lot of people in the first group were managers and or directors, and some of them were not inpatient staff. And so that was interesting. We were hoping for more of the nursing staff if possible. We did have a third shift nurse that joined, so it was very admirable that she was able to stay awake and come on at noon after she had just gotten off from shift. So there's a couple of weeks she couldn't make it, but she really worked hard at it. Appreciated her presence because she was somebody we really wanted to connect with. The gender of the group, we had 2 identified males and 18 identified females, 1 Asian, 1 African American or Black woman, and the rest were white. So it was not very balanced in terms of ethnicity. We gave them surveys and asked them, what was most helpful for you at the end, because we really wanted to know what worked. And sometimes the best way to get feedback like that is to ask just straight out questions and get that story back from them. Folks said the takeaway tools were great and they use them every day. Doing it as a cohort and share learnings in the breakout rooms was really helpful. Some said they couldn't say enough about the safety and compassionate environment that was created by the facilitators. Someone else said they gained coping skills that will stay with them forever. And they also found valuable the feeling of community, seeing my exact same challenges voiced by others in the group and obtaining comfort for that. And that made sense. I participated in that group. Annie led the group, but I participated in it, helped orchestrate things. I was a little bit like Michael here, doing the computer stuff in the background, but also went into the breakout rooms, wanted to know how my staff was doing, used that time to really kind of connect with people. And it was very helpful to hear what folks were sharing in there. Now, the results, we send out those surveys. So 13 people responded to fill them out. 5 completed that baseline. It's that first one before class started and finished the post test. 2 people finished the 6 weeks post test when we wanted to see what had stuck with them, but not one person had filled out all 3 surveys. So we don't have any data the way we were hoping for from that first group to show us if by taking these meditation classes, self-mindfulness classes, were people building resilience. And that it was one of our goals is to be able to show that. But if you can't get folks to fill out the forms, you're not going to be able to measure it. So we had that experience. We went into group 2. This time we changed it to Wednesdays and changed it to a dinner time slot. This is a screenshot of Annie and I in the group. I don't have a screenshot of the participants in there because I didn't ask their permission to do that. So I don't want to break that sort of safety and confidentiality factor. So you just have to see what Annie and I look like. But we changed the time, hoping we'd catch people at change of shift. Maybe the people who go in for third or second shift at 7 could join us before they left home. Or maybe the managers and nurse managers on floors could join us at the end of their day, things like that. And it seemed to work a little better, we thought, because 26 people registered. I did scare Annie when I told her how many people had registered because that's way much larger than what we wanted for a group. But I said people are going to drop out, and they did. Unfortunately, by the end, we only had 7 left. So it's a third of the people who had registered actually stayed in it. And so we're kind of left with what happened in that. Why did we lose so many folks? What dynamic was different? And there are some differences. One of the things is, while it was still a Zoom and it was live, we decided to record it. We had everyone's permission to do that. We still had the same breakout rooms for discussions, but people opted to not be on camera as much, at least in the big group. And I did not join folks in the small group. So I think people did come off camera, did go on camera in small groups, but they weren't doing it in the big room and people weren't sharing as much. So it didn't have the same sort of comfort feeling that the first group had. We did, as I said, record it. the lovely thing about Office 365 and the share drive is to be able to put it there and then send a link to it to share with people who had been registered. So again, only the people who were part of the group could see it. That was also to protect people's confidentiality and to be respectful of the model of this exercise and mindfulness. It's really meant for the small group who are working together. But most folks didn't use the webcam. The group still consisted of nurses. We had more unit nurses, managers, excuse me, which is what we were really hopeful, and we were glad for that. Still had some HR folks, some chaplains, social workers, which is great. A little bit less director and management level, which was helpful. What was a surprise is we had more administrative staff who were working from home sign up for this. So there was another layer of a different kind of COVID stress, of the isolation at home, perhaps starting to have some anxiety about when they would be called back into work instead of being able to work from home. So their stress level was different. And so I don't know how much that impacted how comfortable other people on the clinical side, direct clinical side, felt about it. This group was also less aware of mindfulness techniques. The first group had some folks that were already doing those things. And so I think that helped that group be a little more dynamic because they had some experience with it. In this group, there were out of the whole 26 that are registered, there were no males in the group, and there were so they're all females. Now, the results of those studies was that 18 people completed that baseline. So we thought, oh, great, this is working better. But then nobody completed the post. I think we might have had a computer problem with that. And 2 people completed the 6-week. So again, we don't have much left for a sense of data about whether or not people's skills were better at resilience and better at self-compassion, because the results are not there. So all this is we want to take to learn. The next group that will happen later this fall. We want to make sure we don't do it during the summer, so people are back from vacation and are more able to be part of it and maybe have a little more sense of safety as COVID has gotten less pervasive. One of the things that also happened as we started to advertise for this is people needed something different. So there's a nurse educator that here facilitates our nursing residency program. So it's for new nurses to come and be part of this group for a year, to really support each other, continue learning, and they can't take 6 hours over 6 weeks to come to this class. So there was a request, could we do something for them for an hour? And so we did 2 groups with them where Annie led in a more fast-paced workshop kind of style of giving some of the tools, not all of them, obviously, because time just doesn't allow for that, but giving them a sense of the tools, having a little bit of practice with them. And then the nurse educator who gave a general questions to them, asking some feedback. How important did you feel this training was? And so the first group, out of I think it was about 60 people that were in that first cohort. So 34 of them actually completed that survey and said, 47% of them said, this was great. This is the highest out of 1 out of 5. Loved it, please. And 32 gave 4. So I thought 79% thought this was pretty helpful, which is a great rating. And that really was almost matched in the second group. We had even more nurses in that group. I think it was about 114 actually in the group. Some of them were also facilitators. So that 67 of the nurses completed that eval, saying 40% said this was great, the best, 34 said 4, and 20% said it was good, it was helpful. So it worked, right? And this was really important because these were nurses who had been given a survey about how they were feeling about their job back in May of 2020. And they said they were happy with their career choice as a nurse. But by October 2020, they were questioning whether or not they'd stay in nursing. And so this nurse educator was appropriately concerned and was eager to bring helpful didactics to the nurses to really help them heal from the emotional toll of COVID. These talks were not covered by the grant. Annie provided them pro bono. Really, it was just out of compassion. And the feedback that we got from that group was a lot of, please keep this information coming. And so we do have at times that we're going to do that again with that program to help them in the next cohort that comes through. And also try to look at what are the other groups that need that don't fit into a model where we can do these 6 weeks programs. And so we'll have some discussions with the medical students in the medical student residency program, kind of trying to see what can we do similar and how do we make it robust enough that they can really carry those skills moving forward. So that's all the first part. Remember, there's 2 tiers of the program. So the second tier is training the trainers. And so in order to become certified in the mindfulness self-compassion, you need to take, there's really 3 steps. And the first step is to take an 8-week class or a 10-week online. The second step is to take an intensive 5-day retreat. And the third step is to take the teacher training course or a 6-day intensive. Then once you have finished that, the first class or first group you teach, you co-teach with someone else. So to help you learn and make sure you know how to teach it properly and move through the curriculum. And then you apply for the certification and you get mentorship after that. And so that's that second part where we want to try to get 5 people who work for Mainline Health to be certified in this so that we can continue to offer it here in various ways. So at this point, we've identified 4 employees, and one of them has been already involved with mindfulness self-compassion, the Center for Mindfulness, and has taken several of those long intensive classes. So she could already move on to step 3 and start doing the teacher classes. I've done the online 10-week during this year, and now I can move on to finding an intensive class and then the teach. And the other 3 have to start the process. The great thing is the Center for Mindfulness Self-Compassion is very used to grants, is very used to how to get those projects slots paid for so people can move into those training. So I'm really excited about what we can do with them. And we also built into the grant to cover the recommended books. And you can see the 3 that are listed there. The Mindfulness Self-Compassion Workbook, you're probably familiar with if you've ever done it before. And it just looks like this. And lots of people love this book and have used it with students even. And so this way we have the resources and we can provide that for the folks who will go through the training. So the takeaway is that we really wanted to learn from these 2 group experiences and try to build in the more successful focus so that the next group is very cohesive, really inviting them and reminding them to stay more on camera because that really makes that sense of community happen better. And you could feel the warmth of that first group compared to the second group. And then we want to support folks to move forward in that training because again, that's going to help us build for years to come this sense of resiliency. And as a bonus, we really hope to still gain some pilot data to really help us seek future funding opportunities and workshops so we can expand this to the folks who can't take those 6 weeks to be able to do those special workshops. You know, we can teach a lot in 2 or 3 hour workshop that if we can get folks away from their jobs to do that. And so we need more funding to help make that possible. And that we'll have the trainers for that. So that feels like a really good way to sort of streamline this and continue it moving forward. So that's really the story of this. I'm happy to take questions and talk about things. There's certainly been challenges. It's also been very exciting to do this project. But there's been lots of bumps along the way, which we expected. I'm sure I'm not alone in that.
Yeah, absolutely. Well, thank you so much, Liam. This has been wonderfully insightful, and just hearing about your experience moving through it, not only the process, but how you've experienced it is really helpful. I do want to ask one thing right at the beginning, and there are a number of questions in the Q&A, which we will certainly get to. But you mentioned at the outset, this is the first time you applied for a grant. And when you said that, I didn't realize that was the case. And I thought, no way, because it was very well done. So if you could just say a little bit about the nuts and bolts of what it took to do that, on your part within your system, because I think this is something that a lot of chaplains, there's not training for this in seminary or theological school. How do you apply for grants? It's a complicated process. And the lab, we tried to streamline it as much as possible. Yeah. It's still complicated. So what did that look like from start to finish for you to make this happen?
Sure. And that's a great question, Michael. And I think I also feel like I need to step back a little bit and say that I was talking to a colleague and said, this is the opportunity that's come up to do something to build resiliency. I really want to bring something that's not, but I knew I wanted mindfulness, but I wanted it to not be just in a head exercise. And so I was processing this and how I felt like I need this for me. One, as a chaplain, for my own individual self, I need to learn how to do this, but I also really need it so that I feel like I'm giving my staff everything I can. Because one of the hardest things, and lots of folks can really relate to this, like so hard to watch them getting just the exhaustion they were having and just how tired they were emotionally because they weren't able to give or change the course of people's illness like we would hope. And it sort of takes a toll. So I was really, really wanting to change that for them. And so I was talking about it with her, and she said, this is what you need, is this self-compassion mindfulness, because it's a little more what you're talking about, really wanting to integrate mind, body, and spirit. And so she connected me with Annie, because I had not met Annie before this. And so Annie and I talked, and Annie had done some research before, and she actually helped me calm down, because I thought, research, I need to write like this huge scientific paper. And I was making myself crazy last summer trying to do that and looking up all kinds of articles and stuff. And she's like, Liam, I think it's a little simpler than that. And, and then I went to the meetings with you, and you all were like, please, this is about the service you're giving, make it simpler than that. And that helped me calm down a bit, and just tried to answer it. You guys gave great suggestions about what needs to be in it. Tell us the story about why you want it. What could it look like? How do we measure things? And the self-compassion short form is free, because they really want their resources to be used. So the Center for Mindfulness was just fantastic and useful in that sense. I will say that my wife is a researcher. She helped me edit things, but she did not, she did not write the grant. But some people thought that I had a leg up on that. And I was like, no, I really pushed myself to be able to do this. I just had to get out of my way and stop making it a big scientific project, and really just focus on what do I want to bring to people? How can I use data from that to say how valuable it was, so we can keep having resources to do it, and space in terms of the time space with the hospital to allow me to keep doing that work with folks. Did I miss any of your question?
No, not at all.
Okay.
And one thing that I would just like to throw out as a reminder for anyone who's thinking about pursuing any kind of grant opportunity, project, or whatever, one of the requirements that the lab put on every application was that you have to have an institutional partner.
Mhm.
There must be someone, who essentially has the authority and the weight
Right.
to help sustain this program. That's such an important thing, and I really recommend that for anyone. And again, it's not just about grant applications, it's for any kind of project.
Mhm.
There are lots of great ideas that we can all come up with, but they are working within this matrix of other priorities, other projects. Having that partner makes this type of work so much easier.
Yeah.
Now, speaking of getting out of the way, I'm going to get myself out of the way now, and we'll go to the Q&A here. The very first question. This is a great one. Can you go over the STOP protocol again?
Mm-hmm. Well, I can, because I have it somewhere on a sticky here, because I needed to, and so I have one here and I have one in my home office. The STOP protocol it literally is to stop. That's the S. Take a few breaths. So you're really just trying to get grounded back in your body, observe. So it's taking a moment to really acknowledge, like, what's happening? What am I feeling? What is that feeling? What's the chaos around me, or is it inside me? So you're just being mindful of it. You're not trying to change it. You're not judging it. You're not evaluating it. You're not ignoring it. You're not stuffing it. You're just acknowledging, like, okay, this is what I'm feeling. This is what's happening. And then practice. So you just practice that, and you just go back into your job. So it's really meant to be like this small little tool you can take out and use in 5-10 seconds to help you get back into what you need to do. But now you've placed a little bookmark there, in a sense, in my brain. Like, I've made that moment where I noticed it. So later I can go back and go, man, I was really stressed then. I'm glad I took that moment to acknowledge it, so I didn't carry it in the room and be unaware of it. Right. I think that's part of the issue is we know that we carry lots of different feelings and experiences, and we can't always leave things at the door. That's just not always possible. And especially with COVID, we were wearing it, it was everywhere. Our fears of it, our angst about it, our anger at it, and so we had to carry that. But if we needed to just keep it recognized, and in a sense, then it's checked. We have ownership of it, then I can control it. But if I don't let myself be aware of it, then it can have control over things and I can't access it then.
Right. It's such a powerful small intervention because it requires nothing but, your brain, essentially.
Right. Well, and listening to your body. So we do want to connect to it. The other one that I thought about talking about that was so helpful for me is this idea of backdraft. Um, when you start doing this mindfulness, self-compassion, there's a point where the critic gets even louder because it wants to, it's like, no, I use these skills. They help me get through things. Don't take those away. And it gets a little louder because it gets scared. And that's called backdraft. So that's when you, like, the fire comes back with a little bit more intensity. And when that happens and you have a word for it, you're like, oh, that's what's happening. Okay, that's just backdraft.
Mhm.
I'm not failing at this. I'm actually working the program if I am experiencing that backdraft. It's working. Okay, take a breath. It's good. Maybe the hand on the heart, just get centered again. Feet on the ground, feel your soles. There's all these different sort of tricks to it, or tools, really.
Well, in some sense, this is one of those unintended positive outcomes of all of this over the
Mhm.
past year and a half. Clearly, we wish it was for different reasons,
Right.
but all of this is useful in perpetuity,
Yeah.
right? And I think that people are much more conscious and mindful of their own mental health needs and the small things they can do throughout the day, the month, whatever, to attend to that.
Mhm.
So thank you for sort of walking us through some of these really helpful things that we can do right now. So this is a very specific question, but I think it is very helpful because, of course, the Luce Foundation funded this project. Parts of it could be done, I mean, depending on what type of funds you have access to. Was there a fee for this training? So if someone was going to want to do this on their own,
Mm.
just start it up, what types of costs are we looking at?
Sure. So if you look on the Center for Self-Compassion website, it's usually about $650 to take a class with them. And so that was built into the grant for the folks who need to take these trainings. So it will pay for those services. But if my goal, hopefully, is for a bunch of us to get certified, then we can then offer that through Mainline Health because we're certified folks, and the employees don't have to pay for it. Because it can be part of and that's the support from administration. Will you allow me space to
Yeah.
offer these things to folks as part of my job title now? And so that's why I used that language before. I took one online because there's a lot of stuff more online this last year, and people who were in my cohort were all over the world. I mean, there was someone from Berlin on there, so it was almost midnight for her. And there were people in California. Like, it was really kind of neat to sort of meet all these different folks and to all be working on this and to watch someone else's teaching style. So I had watched Annie for two groups, and then I watched this other person who I was learning from. And what I noticed also is people are really bad at self-compassion.
Mhm.
You really struggle at it. And
Mhm.
I kept thinking that it was just me, that, oh, I'm just not good at it. And then I realized, oh, I'm actually better than a lot of people. Like, I have incorporated these in my life, so I've done a good job. And people just generally are bad at it, and that made me feel like, oh, we need this more. We really need more of this than I realized. Like I said, just for ordinary life, doesn't have to be COVID time. But it was nice to see another educator who taught just slightly different based on their style, and to see how that would fit for me and what will, and so I start evaluating that. But I think her class might have been a little cheaper, but when you run through the center at 650, but I really wanted to make sure it was somebody who is certified, so I'm getting the authentic curriculum that
Sure.
they've vetted.
Well, and as I mentioned, we don't typically talk about that level of nuts and bolts, but it is helpful to understand the scale of
Right.
what a project like this takes. Not everyone has access to $100,000 to do a major initiative, but they may have access to $1,000 or $2,000 or whatever. And these are all things that are worth
Mhm.
considering. Someone mentioned, this is a great question, the gender disparity is interesting and reflects some of this person's experience with staff support activities in their institution. Do you have any hunches around that dynamic or plans to address it moving forward?
Yeah, I think your person's right. I mean, this first off, healthcare is dominated more by women. Dominate's not quite the right word, but women are more highly represented.
Populated.
Right. We're represented. Women are represented highly, and appropriate. And so I think that's part of it. I think also there's a cultural piece about women are already more in touch, or tend to be more in touch with their their feelings. They're more aware of the level of stress and what it does for them. And they're also more used to asking for support and help. I think generally, that's like related. Those are some generalizations. So I was really excited in the first group that we had a couple men, but it didn't happen in the second group. And so in a sense, I wasn't surprised. I was sort of disappointed because I'm like, man, you need to be here. Like, you need this, maybe just as much, if not more, for some of your jobs. I was hoping for more physicians to be involved. And so I think part of it is just, and this is the discussion we were having with the other grant folks, the other folks who've gotten the grants, like, how do we bring these services to people who are too busy and overworked and don't have time for lunch, let alone sitting down and figuring out how to be compassionate to themselves.
Right.
I think that disparity is hard. I also, the disparity of race and ethnicity is also hard. I think we're going to talk about it and plan, but it's hard to say, well, I only want to, I want to make sure we get so many gentlemen in the group or so many of this or so many of that. We really just want to offer something that people want and are willing to try, because we want to heal them, or bring some healing into their lives. So I'm not really sure how we're going to address that in the next phase. It's one of the things we're going to think about and talk about. My biggest thing really is, how do we get people to turn their cameras back on? Because it really made a difference, Michael. Like, it's really startling. I was thinking today, like, did it make that much of a difference that I was present in groups? And the first one that I went around into the Zoom rooms when we broke out, because I did it because I was trying to be the chaplain in that space. Let Annie was in the role of the facilitator. Like, that's what her expertise, let her go do that. And I'll just be like the supportive person in the background. And mostly I did that because I wanted, if I run into you in the hallway, we have another thing to talk about. Mm-hmm. Hey, that was a pretty good group last week. Did you like that? And that some of that happened. And that didn't happen as much in the second one. And so, really looking at why is that? Were we too diverse across campuses? Was it? I don't know.
This is a great question, and I have so many thoughts about it myself. Why do you think people are bad at self-compassion? Is it overachievers? Is it American culture? Now, I'm just going to inject myself here for a second and say, part of it is the fact that chaplains tend to be bad at self-compassion because they give of themselves constantly, right? It's not about me, it's about you. But if we've harped on anything over the past years, that yes, it is about the chaplains, because folks, if you're broken, you can't heal other people either. Anyway, so that I'll get off my little shoebox or soapbox rather and turn it to you.
That's a great answer, Michael. I think this is partly why the Center for Self-Compassion developed this for healthcare workers, because as a group, just like chaplains, they tend to be service focused. What do I need to do to service you? What do you need from me? It's very much a helping profession, and people who go into helping professions tend to be better at helping out, not helping in. And so, like, it just fits with the model of who goes into the medical field, especially nurses and other caregivers like that. Like, it's just at a lot of compassion, but it's often focused out, not in. And so people need permission, I think, to do that. Because I think our culture tells us, even though it's a very selfish culture, it tells us if you stop and take care of yourself, you're selfish in a bad way. Instead of, no, if I'm being self-compassionate, I'm really taking care of my needs and I'm keeping myself accountable. Mm-hmm. So it's not a free pass to just do whatever I want. And we've talked about this. I'm in a work group with ACPE. We talked about a similar model. And they said, well, what about narcissists? Is this going to feed the narcissist? And I said, actually, no, because at some point, part of the focus is the community that we are in this together, and that I'm not alone in this struggle. And the narcissist wouldn't be able to tolerate that. They want to be special. And this actually says, we're not that special. We're all bad at this. We all need to learn and grow in it.
There's a question here about the survey portion. And you mentioned that when the lab put out the call for this grant, that we really focused very heavily on the application. Yeah. It's great to be able to measure and say with numbers, was this effective or not? But this was not meant to be a research project. This was about how do we help people where they are right now. But as you mentioned, it can be difficult to measure this. And so I promise I'm getting to your question here. This person introduced an art intervention for staff support. Fascinating,
Yep.
but still processing how to make it evidence-based. Can you highlight some tips on how you do that survey and how you can sort of quantify something like this?
I don't know. I think I'm not good at that. I mean, this is part of what was helpful, that there's a built-in survey for this work. And the other questions were really just very open. There were certain things about demographics, which the Lewis Foundation wanted as part of it, which is important for lots of reasons to look at who's taking it, who's not interested. And then we just asked the open feedback one, because I think that was the most helpful, because that kind of tells the story. There are certainly other questionnaires that are out there that help sort of measure resiliency and measure people's ability to tolerate difficult situations. This is just one of them. There's a Conor resiliency scale. Now that one you usually have to pay for. If it's related to COVID, they weren't charging folks. But I felt like I had to sort of pare down how many surveys I was asking folks to do, make it less science. Thank God I did, because I might not have gotten any data. As it is, I got very little, right? So trying to make it manageable. It's tricky, it's tricky to do that kind of research, and I'm not that good at it. I will say, and I should have said this earlier, that part of what I have here at my hospital is, it's called LEMUR. It's the Lankenau Medical, it's an Institute of Medical Research. And so I was able to buy some time from a biostatistician and buy some time from the computer guy to help develop these computer surveys to go out so that the data is protected and is confidential, so people could put in whatever they needed to for answers. So I had the extra support there and was able to cover that with the grant, which was helpful because I'm not a numbers person.
Yeah, and I think that depending on what you want to do with that information at the end, if you have every intention of I'm going to publish this somewhere, then yes, you need a validated instrument that is widely recognized.
Right.
If you're not going to do that, if you're going to use it for internal metrics or whatever, there's nothing to stop you from making your own survey and deciding these are the things I care about,
right.
And going from there. I'm wondering, so you have to forgive me, I lost the question. Here it is. I think this is so important, and I know that I keep returning to this, but it's so vital because I've heard of so many chaplains with such wonderful ideas, and then we begin to talk about the practicalities. There are so many things that just haven't occurred to them because, again, you're not trained to do this.
Right.
So this question is, when you apply for funding, are you only funding the trainers, or do you pay staff for their time? What else do you use the funding for? That's such a great question because when you have a project at hand, those budget lines, there are so many more of them, no matter how much they cost, there are so many more of them than you think from the beginning. So anyway, what did that look like for you, Liam?
Well, and I think part of it, I was able to answer a little bit, and I bought time from those two folks who work for the Lankenau Institute of Medical Research. So I had to buy a percentage of their time, which was very helpful. And they're interested in doing this. They're kind of curious what the chaplain's doing over there with this study. So that was a dynamic. I didn't need to do that because my administrator was fine with me utilizing it this way, as long as it didn't interfere with my other work. And I did take the mindfulness, the 10-week class online. I did take it as part of my work time because it directly, allows me to recharge, and that teaching is coming right back out everywhere with my students. And then of course with patients and staff on the floor. So that was protected time that may not always be possible. I think that's when you're asking the institution to really support it in a way, so that you don't have to try to backfill my salary with that. I think it depends on what your institution's like. This is a very community-focused hospital, even though we're large as a system. It still wants that community feel, so it's a little easier for me to do that. Whereas I know other institutions are going to want people to really buy that time. Right. I knew with the Luce, it was going to be so competitive getting the money, and there was only so much money available that I couldn't ask for big dollar signs because I just wouldn't be able to do it. So I had to figure out, how do we make this affordable? And of course, we're paying Annie for her services because she's a professional coming in and doing that. And she's been very generous with her time, I want to say.
I'm getting a number of questions, and I think I can handle a number of them at once. Any resources that we've talked about, the books, the links, all of that, you'll get that as sort almost like a digest with the follow-up email that has the link to that recording and the survey. So all of that stuff, don't worry, you will certainly have access to that as well. A question on the efficacy is really interesting. Do you feel that having a cohort at your hospital, how much of a difference do you think that has made? And Helen, I'm going to sort of modify your question here. How can we scale that up more generally?
Yeah. It's a good question. I'm not sure. I think part of it, I'm still processing it. I think what has been helpful for me, in a way, I've become visible in a different way through this project. How I recruited folks was through the leadership meetings where all the managers and directors were at. So it really got around not just this hospital, but the other hospitals that this project was happening, the chaplains were available. So now when my system talks about how EAP is available, always listed after that is the chaplain. That might not have always been the case because we really stepped into that role in a much bigger way. So that helped with broader sort of visibility. And I think because there were a lot of managers and directors, it gave me different connections with people in the hospital because they took the training with me. Now they know who I am. I see them on the floor, and that sort of snowballs that networking. But to keep doing it, I think is really to keep doing the whole thing, which is why we want to train the trainers so that there's lots of folks keep bringing it all the time, so that it does get bigger.
I want to return briefly because there are a few questions that touch on this. I'm going to sort of bring them all together. You mentioned trying to figure out what is the best time, literally, to engage with folks. And I'm wondering if you got feedback from folks once they were actually in it to say, I mean, I'm completely imagining this scenario. So if it didn't happen, tell me. Sure. But I'm imagining someone saying, Liam, I'm really busy and I didn't think I really had time for this, but I'm glad I did it. Right. Yeah. I mean, so what does that look like, and how has that informed how you might do this moving forward, or considerations that other people might have putting it into their institutions?
Well, and we actually did poll the first group when we finished what time they thought would be better for the nurses and the staff on the floor. How could we support that better? And that's how we came up with that at the shift change. And it sort of worked for a little bit, but what we found is some of the numbers dropped. And that's when we decided to start recording it and send out the Zoom recording so that people could catch up. And that did work for some folks. They would watch it and they'd be back the next week. But not everybody returned. Of course, as we saw, the number was so low at the end. So I think there's a way to do that maybe, but I think that I've got to work on helping people have a little more buy-in at the start so they stay involved. And I think that's why we wrestled with, do we share the link? Because then they don't have to come anymore. They could just watch it later on their own time. But that took away from the sense of community that we were also trying to build. Not just the skills, but that we're doing this together.
Right. Yeah. Well, and that's, the lab itself is an organization that offers any number of community-oriented resources. That is always a difficult line to balance because these things take time and resources to put together. And you do need a stable community that's going to take advantage of it, but you also don't want to make the barrier so high that nobody can come. We're getting into seeing how the sausage is made, but it's so difficult to strike that balance. Let's return for a moment to the issue of self-care. This person says, please address the spiritual aspect of self-care. As a chaplain, there's a special way to encourage self-compassion. Of course, this is determined by, to some degree, your own background, but what does self-care look like for a chaplain as opposed to anyone else on the unit or in the institution?
I mean, I think part of it is, the work I do with my students all the time is making sure that people take breaks to eat, go to the bathroom. I mean, literally yesterday, I was here with a student and it looked like the day was going to get really crazy. And we were both at the cafeteria, just ran into each other, both getting lunch. And I said, I want you to know I'm going to cover the pager because I really want you to have your lunch. I don't know what's going to happen the rest of the afternoon, but take time to have lunch. I ate my lunch at the same time. Nothing happened. So we both got to eat, but she relaxed in a way that she needed. Because she came back to the office and said, oh, I took my lunch and went outside and I did this and that, and I feel great. Like, that was so helpful. Thank you for covering it. Like, it didn't even cost me anything, you know, and my head just was sandwiched. I could have left it there, no problem, and run and taken care of something. But just having that space and help reminding people to take that space. Um, and we do have a chapel meditative space. We do have grounds that we can walk around that are safe and beautiful, like, and just always reminding folks to do that. Take some time in between visits, because you've got to regroup before you go to the next one. At this current time, my hospital actually has made the coffee free in the cafeteria. And one of my students in the fall named it Sad Coffee, not because the coffee's sad, right? It's Wawa coffee apparently, and it's really good. She likes that. But she came from an encounter that was sad, and she went to the cafeteria, forgot that it was going to be free, got a coffee, found out it was free, was like, oh, this is awesome. And she sat for 5-10 minutes and had her coffee, dubbed it the sad coffee. But in that moment, she regrouped.
Yeah.
And then she got up and she said, I felt like I go do the next visit now. And it was like, yes, that's exactly it. Like, build that in. So now I teach my students, go get your sad coffee or your tea if you don't like coffee. Like, build in that mechanism so you take a few minutes to just settle down, because you're going to recharge better then, and then can go move forward.
This is absolutely wonderful, Liam. Thank you for this. I would like to direct folks. We had a webinar a few weeks ago on another project within this series up at Pine Rest in Grand Rapids, Michigan on staff resilience. It was a really interesting project, great webinar, but it was a totally different setting and a different intervention. So I would encourage you to go watch that. We will have another 1, 2, maybe more webinars in this series between now and the end of the year. So do keep an eye out, because they are all on this theme, even though they are doing it very differently. So please keep an eye out for that. I think that if you enjoyed this, you will certainly enjoy those other events as well. Thank you so much for your time, Liam. This has been wonderful. Thank you to our audience, as always. You'll get the recording, so if you came late, don't worry. You'll get to see the beginning of it as well. Check out that survey in there as well. And then, because we are in June, I will also ask you, if you visit chaplaincyinnovation.org, the lab's website, we have a button right there for our summer appeal. We have a number of folks who have offered fantastic matches to us, but we can only unlock those if other folks give as well. So please take a moment to check that out and consider giving to the lab. Thank you all. Have a great afternoon. Bye, everyone.
Be well.